Austin just changed over to a new way to warn about COVID-19 risks, all while a new variant grows nationwide. Gone will be stages 1 through 5.
Recommendations on masking and gathering will focus on low, medium, and high. Now, depending on your vaccination level, you will be asked to take different precautions based on the current number of cases.
This as the Food and Drug Administration okayed a second booster for Moderna and Pfizer patients aged 50 and up. The Centers for Disease Control and Prevention also finds the new BA2 subvariant of Omicron estimated in more than half of all U.S. cases. It is considered more transmissible, but not necessarily making people sicker than the regular Omicron.
And on this same day, Austin Travis County's health authority announced its COVID-19 risk-based stage system is dissolving. Texas reported an uptick in the number of BA2 subvariant cases here in our state.
KXAN's Blake Devine stopped by a city-sponsored testing site today to see if people there are preparing for another COVID spike.
So there's 40-something, 76.
Things have significantly slowed down at Austin's only city-run COVID-19 testing site. Inside, just a few folks, including Jackson DeBro.
My grandma's coming this weekend, and we just want to be very sure and safe before she comes in, and so getting a test is to make sure I'm negative.
This comes at a time when Austin Public Health is ditching its current COVID-19 risk-based system,
the CDC,
aligning itself with the CDC model, which only recommends masking in the high-risk stage for people who are up to date on vaccines.
After our winter surge in late December/January, we've really seen the numbers die off. This is the only site that's open. We're doing about 160 a week.
With far fewer people getting tested, this could cause the virus to spread and go undetected.
We just need to sort of have these habits of knowing where we stand, just individually and as a community.
According to the Texas Department of State Health Services,
to keep our case numbers down.
Roughly 30% of newly reported COVID cases are the BA2 subvariant.
The problem is that when there's a spike, it's always a spike, and so we're always way behind the curve in knowing where we are.
And despite plenty of people coming to town for South by Southwest,
during South by Southwest, we didn't see that increase in cases.
Only 100 COVID cases have been linked to the event thus far.
If we have another surge, then maybe it'll pick back up, but I think for now this is probably going to be the new normal.
This free testing site at Metz Elementary is open Tuesday through Saturday from 11 a.m. to 7 p.m. Blake Devine, KXAN News.
As health officials update their tracking methods, we're updating ours at KXAN.com. Make sure you check out the county-by-county numbers to see what the current spread is in your area. CDC is evaluating this week whether or not to end Title 42, the public health order by the administration to turn away migrants at our southern border in order to prevent the spread of COVID-19.
Title 42 is set to expire on Wednesday, but as KXAN's Anna Warnicki reports, lawmakers are warning the administration to not end it without a plan in place over fear of what that would do to our border cities.
It certainly feels as if Texans have been forgotten.
Texas Republican Congressman Tony Gonzalez tweeted these pictures showing a group of 187 migrants apprehended Sunday by U.S. Border Patrol agents in Eagle Pass.
It is as bad as it's ever been. It's only getting worse.
Gonzalez warns the number of migrants crossing the border will double overnight if the Biden administration decides to get rid of Title 42.
What you're going to see is a humanitarian crisis on steroids.
Title 42 is a pandemic public health order that allows Border Patrol agents to immediately expel migrants that do not qualify for asylum.
Title 42 is set to expire on Wednesday unless the CDC and administration decide to renew it.
They have no plan in place to deal with what is already a disaster.
Republicans and Democrats are urging the administration to not end the policy without a clear plan that protects border communities.
If they do eliminate Title 42, that they have a plan to address it, both from a public health perspective as well as from the perspective of Customs and Border Patrol.
The White House has repeatedly said any decision on the future of Title 42 is up to CDC.
And we are currently reviewing the data and evaluating it right now.
The agency's director, Dr. Rochelle Walensky, says an announcement on whether to keep the rule in place could come at any time.
In Washington, Anna Warnicki, KXAN News.